So HLA PPT is a trust promoted by HLA Life Care, and it's a 21-year-old trust. It's a national level organization working on HIV/AIDS prevention, RCH, maternal child health, and we have a wonderful mission of touching people's life with solutions for health. So this particular cause is very close to our vision, organization vision, that is working for the CLHs, the children living with HIV and AIDS. As we all know that Andhra Pradesh is one of the highest prevalent states with HIV epidemic in the country, and HLPPT had been working with Bill and Melinda Gates Foundation funding for now almost a decade in the most high prevalent districts, coastal night districts, to work for prevention of HIV/AIDS, and the work had been closely to reduce the prevention and to bring in health related behavior changes in female sex workers, men having sex with men. In the process, over the years, while we had been very successful in imbibing those behavioral changes in these vulnerable women and men, we also understood that there are many other social causes which contributes to the vulnerability of this community. So basically the work was expanded to see that their vulnerabilities are addressed by empowering the community themselves to take ownership for their prevention activities. So in the process we had been able to form quite a large chunk of leaders among the female sex workers, and now by the end of around 10 years there are 18 community-based organizations led by the female sex workers with a membership of around 30,000 women across the coastal belt of AP, and it's very encouraging to learn that this whole effort has been instrumental in bringing down the whole HIV prevalence in the coastal districts to a large extent, which is helping to stabilize the HIV epidemic of AP per se. So this particular thing is about the children who are living with HIV. We all know that the number of children in India living with HIV is very large. It's a very, very sensitive issue when children are born with HIV. Their lifespans are sort of unstable. They have to go through ups and downs. They have to feel stigma. They feel sick. They have their dreams which may not come true. The parents are in a constant agony. So we are very touched with S. Lakshman, who had been the ambassador for this particular cause. The whole idea is to have him as a brand ambassador who to give to such children who are living with HIV, or the children of the PLHs. The mothers or parents are HIV positive, so those children are vulnerable. Around 100 schools across AP sensitize the schools children as well as the teachers, and through the children to a further larger audience of their relatives and their parents, so that they understand the plight of the and they have their friends, they have that sensitivity or the bondage across the schools to stand by these children, and also to see that these children also raise funds for their friends who are living with HIV/AIDS, and these funds in the process will be helping the children living with HIV/AIDS in their education, in their health, in getting better scopes of progress in life. So we are very hopeful that with a sportsman like Mr. Lakshman being with us, standing for the cause, it will bring a lot of change in the lives of those little children, those beautiful children who needs dreams in their eyes. Actually, the whole destigmatization of HIV is a mandate of Government of India. So the Department of AIDS Control, what was called NACO, had been very strategically working now for almost more than 2 decades to work with the general population, to bring in sensitivity in the population. We have seen lots of, I think India's HIV program is one of the most acclaimed programs globally, whereby we have been able to normalize things like condom. We all have seen that condom word is no more a taboo. We have been also seeing lot of efforts, lot of campaigns, lot of interpersonal communications going going on through government, which has been mainstreamed to let people know that what are the methods by which HIV can be prevented. So as to put it across like that, this particular project is just one drop in the ocean that whatever India is doing. So there are several other organizations, several strategically devised donor supported and government supported programs which are parallelly working on destigmatization of PLHS, CLHS and this particular community who are vulnerable.